Good afternoon, everyone, and I'm immensely proud sitting here. As in the morning, Dr. Ganesh said, we have crossed 100. I mean, that's a big achievement in terms of FETP graduates. And this is a very informal, though we have labeled it as panel discussion, it's more like a fireside chat, where we are going to informally discuss with our FETP alumni on various aspects related to FETP and how they are actually using FETP skills. So it will not only be about reminiscing what they went through, but also reflecting on how they are using the skills, what do they think about FETP now that they are graduates, and what will be the way forward. So usually there will be a round of introduction. So let me first begin with Seema. So Seema is a district epidemiologist and she is from Chhattisgarh. She is our cohort 1 Chhattisgarh graduate. And I have with me Prashant, who's a senior NVBDCP officer from Udupi, Karnataka. So he is our 2-year EIS alumni from cohort 2. And we have with me Tejpal, who's a senior technical advisor for RTSL. And he is our cohort 3 NCD FETP 2-year alumni. And we have Dr. Mamta, who's our state NCD epidemiologist. She's from Haryana state, and she is our IFETP alumni. So we have got people from different batches so that we'll get a different perspective of things. So I thought first, let's begin at the beginning. First I wanted to ask you, Prashant, while you were applying for field epidemiology for this program, what were your thoughts? What did you think, why you should apply? What were your expectations? And then can you take me through that process?
Yeah, thank you, ma'am. First of all, very good afternoon to everyone. It's a bright alumni here. Good afternoon, sir. So, to answer your query, so it was almost 2 decades in my career when I applied. Okay. So I joined Government of Karnataka in 1999. And then over the period of time, I realized that I had to focus on program management, and I did my MBA in healthcare management. Okay. So that led to my career in WHO. Actually, I was absorbed in WHO as consultant. Okay. So I worked in WHO on deputation basis for almost 6 years. Amol is here. He was my earlier colleague. So in WHO, there was a story that time. In RNTCP, our father of RNTCP is Tom Frieden. So you must have heard about him. Yeah. So Tom Frieden's father is a neurosurgeon. And then there was a story going around. His father used to ask him, I'm great, and there was a healthy discussion between them. And he used to ask him, today I have operated a person with critical, trauma and all. So I actually made him survive. What did you do? Okay. And Tom Frieden actually answered him, saying that I attended a meeting and I started RNTCP and I saved crores of lives. Okay. So in one meeting, he could actually, so in 5 hours of operation, his father could save one life. And in that 5 hours of meeting, he could actually save crores of lives. So that drove me to the public health, and I took it as a career. And then when I came back, I did my MPH as well. But all these years, I was actually applying, the what aspect of, the epidemiology. So all these years, I was applying the same thing. When I was in WHO also, it was more of a program management rather than going to the depth of epidemiology. But then I realized that I have to do something to answer why part of it. Correct. And then somebody told me that EIS is a very good, platform for that. And then with an expectation of, exploring more of why part of epidemiology, I joined NI FETP as an EIS officer. And that program really, lived up to my expectations. So I had very good backup, and my mentor, Mohan sir, is here, and madam is here, actually, who hand-holded me. And throughout, it was one-to-one mentorship, and I loved that one. So that way, so my expectation of the answering why literally met. So I could actually learn a lot of skills here, analysis, SOCO, and lot many things. The presentation, communication, and all those kind of things. Yeah, thank you.
Thank you, Prashant. I think a lot of the people are searching for answers. Why this outbreak? What are the important risk factors? Or why my program is not functioning? I think these are some of the questions which many of our applicants have in their mind, and they want answers. Probably that's why they are applying to Field Epi. I think excellent way you summarize that. My question to you, Mamta ma'am, is like, when you were undergoing the training program, did you really feel like, were there some moments where you felt, wow, I have not really thought about this way, or wow, I've never learned about this? I mean, it's a self-serving question for us, but so.
Ma'am, coming to ICMR was first wow for me, actually, because I know before that interview, that online interview held, I have to I don't know how many excuses to my officer just to attend, and I knew I was late. But thanks to the faculty, they attended me, and I was thinking that they will not consider me because I was late in that interview. But I was so happy when I got considered, and of course, the administration, they helped me a lot for submitting the all process. So finally, when I came to NI, that was the first moment of wow. Then meeting the faculty, I was in a dilemma in my job. I am an epidemiologist at that time, but people are keep saying that you're just doing data thing, huh? You're just doing managing thing. It's not epidemiology. But I remember first lecture of each and every faculty keep telling us, you all are epidemiologists. You're doing good to the health, and that really boosts us. So every moment was wow. But yes, there are so many events when I won IFACON award, which was I think after a long time, and I was with my family, I could set example to my son that at this age I was again winning an award. And he was wondering to see my teachers that, ye aapke ma'am hai? So how they are supporting actually. There was a really amazing moment in Manali when it was not like our mentors only. Every mentors were helping us in removing our confusions. So that was one of also wow moment. And when, ma'am, honestly, I was asthmatic, so I never had a part to play sports in my college time even. So I won here, the throw ball game that I participated. And I went to the stage for dance performance. So, I mean, all those were wow moments. And meeting faculty and colleagues from different part of India, which was impossible anywhere. So I can say, yes, it was a golden period for me. And there are some starling diamonds for that award, I can say. There are so many moments I can recall, but these are few moments I can tell. Stories can keep going. Thank you.
I think the IPHA Con, the Manali conference, the Varanasi conference, I think many of them have said that these are some memories that people will cherish forever. I think not only about the technical aspects, but I think the other aspects also stood out.
Yes,
And my question to you, Seema, is like, looking back now, it's almost a year, right, since you have graduated. Do you think that undergoing this FETP training has had some transformative value for you? Did it really transform you? What do you feel?
Ma'am, first of all, I have to thanks everyone to make me in the panel's member. I came from the Chhattisgarh, southern Chhattisgarh.
Correct.
As everybody knows that this Bastar is Naxalite area,
Yes.
and I am local of Dantewada, Baladila. So first, when I am doing graduation, that my dream is only thing that I have to do job to earn money. But after joining the National Health Mission, so many friends I have made. They have given me so many dreams like that, what you have to do in futures. First, when I have joined NHM, then that time I am the NCD consultant in the Bastar. So that time I have faced so many things, because that time in Chhattisgarh, initial period of NCD program is running. Means first 2018. So I don't know anything about NCD, and I'm learning, and so many pressures for the datas. You have to collect datas, you have to do analysis, you have to present in front of the collectors and all these things. And so many pressures by CMHO office also. So I got fed up, and and I applied for another post, and I got selected as a district epidemiologist in my home district, Dantewada. Then my senior, these state nodals, my MDs, they have very supportives, and I got opportunity to apply this ICMR NI in 2022. Then in interview, I got, means I am so much in fear that how my interview will go. But luckily I got selected. And when first session is held in Chhattisgarh, literally I will say that we have studied, but we haven't done the practically in the field. So I will say that I will have zero knowledge, only theoretical knowledge there. But after ICMR, this FETP, what is the value of data? With data, I can do so many things. How to analyze. With data, I can interpret it in my districts what's going on. In front of higher authorities, in front of lower level also, I can say why this data is very much important. And because of data, we can interpret, and we can say that because of this, this is happening. Because of that, this is happening.
Correct.
Like that, we can interpret. And because of this, my presentation, PPT presentation is also very much better than before. And before we are using Excel only for a table and only for percentage. And from state level also, the peoples, when we are going for the state review, most of them, they are showing only the percentage that within the district levels, that Dantewada district is lower than Bastar, Bastar is lower than Raipur, like that they are showing. But now we are coordinating with state level, that why denominators is important, numerator is important. Not every districts are same, their populations are different. Yes, so how to interpret that? And in many ways it's helped me, because I will take the example of my districts only, Dantewada. Most of the peoples are not that much educated. Most of the peoples are till now the literacy rate is not more than 50%, and the local language is their tribal. So when I am going for any outbreaks, that time I face so many difficulties, because I am the localites, but I too also don't know the local language. So I have to take one translator, whether in most of the district, state calling Ashas, but in my state calling Mitanins. So I am taking the help of Mitanins to translate my questions to the respective persons. But they are also not understanding कि why madam is asking this many questions. आउटब्रेक ही तो हुआ है, इसमें इतना ज़्यादा हवा करने की क्या ज़रूरत है, वो तो होते रहता है मैडम, उसको बस हम लोग रिपोर्ट बना के दे देंगे, स्टेट्स वाले लोग भी शांत हो जाएंगे. लाइक दैट परसेप्शंस वाज देयर. बट नाउ व्हेन आई एम टेलिंग देम कि क्यों इम्पोर्टेंस है, अगर हम लोग आउटब्रेक इन्वेस्टिगेशन करते हैं और उसको हम लोग इंटरप्रिटेट करके एनालिसिस करते हैं कि क्यों हुआ था, किस कारण से हुआ था, तो उनको भी समझ में आता है कि हाँ, अगर ये कारण हमको पता चल जाए तो इन फ्यूचर्स फर्दर आउटब्रेक होने से हम रोक सकते हैं करके. सो आई हैव टू मीन्स बहुत ज़्यादा ही मेहनत करना पड़ा था इनिशियली. तो बहुत ही अच्छा एक्सपीरियंस था, क्योंकि उन लोग भी इंटरेस्टेड थे कि मैडम कुछ अच्छा सिखा रही है. हम लोग सिर्फ डाटा कलेक्ट करते थे कि हाँ मैडम डाटा देना है, 100 लोगों का 200 लोगों का कितना आउटब्रेक हुआ है, सबका स्क्रीनिंग करके भेजना है. बट वाई इट इज़ इम्पोर्टेंस, दे अंडरस्टूड नाउ. सो एट द एंड आई कैन से दैट इट्स like dreams come true, because I am only doing the practical knowledge before, but I can do now practically. And now I have promoted. I have went to from Dantewada to Sarguja. This is also one tribal that is, division is there. Now my post is district urban manager. So now I am seeing my whole urban area. So before I have done the outbreak investigation, now I have to see whole urban area. I have to see urban area, this migrant populations. Then I have to they collect data, very difficult because migration people are not staying one place. So I am facing different problem in urban as compared to rural. Yeah. So I am not saying that I am fully applying everything in my day-to-day work life, but try to apply minimum. So that I can make the policy makers, I can say the states consultants or the nodals that what I am seeing in my urban area, or let I will say an example. Then
Like-
RC, okay.
No, जो आप बता रहे हैं वो सब बहुत अच्छा है. My question is कि personally भी कुछ transformation हुआ है FETP के बाद में?
Yes.
Professionally तो बहुत कुछ हुआ
Yes,
है.
ma'am.
अब तो
Ma'am, I will say that first I got opportunity to do my first poster presentations national conference in Kolkata. This is my first. I don't know how to do poster presentations because in my MPH I have done thesis but not the presentations. So this is my golden time that I have presented in front of everyone, and they have appreciated me also the poster presentations. Then here also in FETP also presentations in between the cohorts we are doing. There also we are discussing and confident levels. Now I can do presentations and I can say the reasons why this is important and why I am doing this in front of collector and CMHOs. So if they are asking क्यों ऐसा ज़रूरी है क्या ऐसा करते हैं, then I have valid reason कि क्यों ऐसा करना चाहिए हमको, ताकि हमारे जो कम्युनिटी है उनको बेटर हेल्थ मिल सके, बेनिफिट मिल सके. तो वो भी हेल्प किया. विज़न देखने का परसेप्शन मेरा चेंज हो गया कि हाँ कि सिर्फ काम नहीं, हम लोग को कुछ बेनिफिट भी करना है कम्युनिटी के लिए लगे. थैंक यू.
Thank you, Seema. I think through the course of any training, I think there is some transformation that happens. But I think the range of transformation that happens in FETP is, I think, wide, varied. And sometimes even personal transformations do happen. So, like, question to you, Tejpal, is like, now that you are part of the FETP network, do you think that the FETP network has supported you through some collaborations or networking, or has it increased visibility? What do you think?
Yeah, definitely. Like almost 8 CVHOs joined FETP NCD cohort. For me, like we worked as a team on multiple projects. We were working on individual projects, but we used to discuss together. Like we used to have calls in the evening, sometimes with mentor, sometimes without mentor. And that helped me to collaborate with each of the CVHOs. And when I went to Delhi on my deputation, so that connection with all the CVHOs, understanding of the different systems, health systems, and the program, that helped me to work with Dr. Amol and Dr. Abhishek at the national level on the IHCA. Second thing, like there were other officers from other programs, other states. So if I want to know something about cancer clinics, I could call Saurabh from Chhattisgarh. So there were some opportunities I learned from Kerala team about their health system, and if I had some questions, I wanted to some innovative things, I could reach out to them. So those collaborations definitely helped me, and that skill actually is helping me in current job also to talk with people, make those connections and network. So definitely that is one important thing. Second, about the visibility. When you say you are FETP, you get that visibility. I will give example. This April I was in Atlanta, and we had definite meeting with the definite team actually in the evening dinner. And we met some people in Panama conference, and that connection. And then when you say you are FATV from Chennai and I, so that visibility is always there. And when I go to different countries for the project-related activities, if you know that that person is FATP, that connection is always there, and you will think in that sense. and we will try to make that connection and how we can work together, how we can collaborate. So that opportunity, because of the visibility which NIE has given, has helped me. Yeah.
Thank you, Tejpal. I think personally also, I've also benefited from like mentoring many NCD cohorts. When I first came here, I came from a clinical institute with not a lot of program experience. And then within a year, with the first FETP, I think personally also, I also went through that kind of information where I could meet all different districts. So now quickly I want to ask, just 30 seconds, like which competency do you use the most, Mamta ma'am, now from what you have learned?
Ma'am,
Which one do you use the most?
No, it's connected actually. Data analysis helped me to evaluate my program because then I can find various flaws. And when I know the flaws, I can rectify it. And because of data knowledge, I have the confidence. I can speak anywhere, whether it's MD. If my data is showing low performance, yes, I'm agreeing it.
So
if
data
it is good,
analysis,
yes,
that is
yes,
the most used.
very useful because then it is the basic. Then you take another step after that, and it gives you confidence whenever you're talking in front of your seniors.
Okay. What do you think, Prashant? Which one do you use? Quickly.
Yeah, for me, if I have to list out, so I have three.
Okay.
The first one,
Not
as
one,
ma'am said,
three.
yeah. So
Okay.
the first one, as ma'am said, it is data analysis,
Okay.
which is bread and butter of any epidemiologist.
Okay.
So that's a day-to-day worthwhile this thing. And the second one is communication, which I learned here in NIE. So the communication has led to a lot of, I could bring a lot of projects in CSR.
Okay.
That is just because of, communication skill beyond the epidemiology.
Okay.
And third one, I think so, it's very important, outbreak investigation.
Outbreak.
For my program as of now, I'm as a vector-borne disease control officer.
Okay.
So it's a most infectious disease. So obviously that skill helped me a lot.
Okay.
Yeah.
Seema, you?
Like sir, I have also listed.
Okay.
So first I will say the communications.
Okay.
Because in front of higher authorities, what language, what word you have to use,
Okay.
and we differ from the lower level.
Okay.
So communications, then data
Data analysis.
analysis, because how data you are collecting,
Okay.
you have to interpret it. So
yes.
in which post I am there,
Okay.
so communications, data analysis and interpretations, I think so most. Yeah.
You, Tejpal, now that you are senior technical
Yeah,
advisor,
for
do you
me,
still do analysis?
Yeah, I
Not
do
sure.
some, like, actually I guide the team members or the partners on data analysis. So that is definitely helping me.
Okay.
Many times, because in FATP NCD we learned many times you don't do directly the data analysis, but you have to guide people what inferences you want, what exactly you want to learn from the data. Second thing, the written communication.
Okay.
Presentation, definitely that skill I use a lot, but the written communication also I have improved a lot myself. I have that feeling. So yeah.
Nice. So, Mamta ma'am, can you tell me like one example of how this program has practically helped you improve something in your state or district or?
Ma'am, I want to give a recent example. I was talking to Dr. Morgan about it.
Okay.
Actually, other than this data and everything, we were about to, we are developing a book on obesity in children so that we can start it with the children awareness. So this was the mission director's vision, and he gave this assignment to some web designer. And obviously, they just did whatever they like we have given them, and with lots of mistakes. Ultimately, we have to find a web designer, and my web designer was very busy. When I saw the basic file, it was Canva. So when my sir said, "Ab kaise karenge?" I said, "Koi baat nahi, sir, I can handle it." And I designed the whole book in my way and represent it to the MD and everybody. And despite of our bad performance in our state, अभी बहुत NCT में हो रहा है. Sir was very happy. ये book बहुत अच्छी बनी है. So that is what recently I did. So thanks to the faculty, that time we remember everything, whatever we have been taught. So I'm really grateful for that.
Thank you. Seema, one example of क्या अच्छा हुआ है आपकी district में due to FETP?
Due to FETP. Now I am, whatever data I am collecting, I am interpreting, and in front of higher authority, I am trying to explain that why we are below in that program and why we are good in that programs. So in front of MD, when we are going for the review meetings, I have valid reasons that why this program is poor.
Correct.
So like that,
Yes.
it's helped me. And the presentations, where in my district the presentation is very simple, they are doing only the percentage, but my presentation is something different. Madam, ये क्या बनाते रहते हो, इतना ज़्यादा time waste क्यों करते हो presentations में? Like that they are saying. So I am teaching my operators auto data manager also that why this presentation is also necessary, differ from higher level and lower level with simple language.
Nice. Prashant, one thing that...
I have many things, but
No,
for
one only.
time's sake, I'll just give you quickly two.
Okay.
Okay, one, we did KFT, surveillance evaluation during our this thing, and it got, published in IJID, and then that transformed policy as well. So because of that publication, the vaccine that was produced in, animal husbandry laboratory, that got stopped. So that was one, and now the guidelines is being reformed. So that was one policy change we could bring in with that particular publication. That's one. The second one was a big outbreak which happened in Chitradurga. That was an atrocity case actually threatening most to the district administration, which we could actually decode and, ultimately we could save the district administration. So that was a great impact, outbreak investigation we did. So these were the two examples I can quote.
And Tejpal, what is the one thing that FETP has helped you?
Yeah, like I have two examples. One from so I did QI on calling patients who have missed visits. So in that, like actually when we did that intervention, that was only in 3 facilities. But actually that intervention helped the other facilities in the district, especially the hospitals, to make phone calls to encourage those facility staff to. So that was like one intervention which is like continuously. Still also the people do phone calls to overdue patient. That is a small change but has like larger impact. Second thing, it helps me in data-driven or evidence-based recommendations. Especially like last week only we had a talk in one country about changing protocol. There was a drug and dose specific protocol, but they were thinking to have a generic protocol. But the methods we have learned or what data or evidences we have generated in India, actually that knowledge sharing actually helped us to convince the minister, vice minister in that country. So these protocols work, these are effective, and actually he agreed to continue the protocol.
Yes.
So
Thank you. I think excellent. I mean, the wide variety also of how impact is being, some in different countries, some like saving the administration, trying to find the reasons, and of course, even like developing the design of a book. I think all excellent examples of how to use FETP. Now, to wrap up, and last few questions that I have is, now that you are doing things differently, as I see that you are doing, do you think that there are some further challenges as to why, FETP skills cannot be employed effectively? What do you think, Prashant?
Yeah, just to answer this, we have moved to the digital platform with IHIP, but still there are some national health programs which are still running under, paper-based. For example, NVBDCP. So the vector-borne disease is still, in some parts of the countries they have moved to digital, but still it is majorly it is paper-based. So that is a difficult thing in the sense that we get inconsistent data, and the paper-based this thing has its own inbuilt problems. So that is one thing. And the second thing is, the network problems and, digital awareness, software issues, and there are a number of other things. So resource limitation, HR, and most importantly, the administrative staff not knowing the importance of correct interpretation of data. So that is one more this thing. Even if we say, the correct interpretation, ultimately if they understand, that will be good. So if they are not understanding, that will be very, very difficult for the program. So these are some of the challenges, but what I can see is with this FETP going on, so last 12 years or so, 2012 onwards. So now that situation is gradually changing, people are moving to digital based, and people are getting to know the importance of data analysis and correct interpretation, things like that. It is moving towards positive way. Yeah, thank you.
Mamta ma'am, in the NCD program, are you facing any pushback? We know that there is like a lot of challenges in the FETP where you want to implement FETP ideas, because the NPCD reporting is mainly number based, right? How many have you screened? How many have you enrolled? Have like implementing the FETP idea of bringing in the denominator, trying to find out like what are some of the challenges that you are feeling?
There are many challenges actually, ma'am. But like if I can count, like just said, data quality, HR, capacity building, and administration understanding.
Correct.
Then sometime we need to fabricate depending upon the audience we are going to show it off, and sometime it's a news we have to like. So there are so many challenges, but I think in FETP what we have learned that challenges will exist always there. We have to find a way how to get like make a way out of it. And in case of data, yes, it is there, ma'am. There is there are two reporting formats still. One is national NCT portal, which is still having so many flaws. And even the not in the portal itself, but with the I can say data people, those are entering it. Some people are doing it duplicate. Some are just doing it in the sake of the updation. So quality data really suffers. And other part is opportunistic screening. I remember we did the exercise on Form 6, and it has ultimately has been at least changed by Government of India. I had changed it otherwise from my side after having that brainstorm exercise. But ultimately, Government of India again changes it. Then we were in like which to implement. It's again complicated, and we keep bitching about it there that it has some flaws, and that flaws we can find because of the FETP knowledge only. And we can, whenever we keep asking them, call us there, we want to discuss about this. So we are facing challenges, but we are making way out of it also.
Just to add, just one point I'll just want to add. So even if we are moving to digital format, so there are 53 national programs now. And each program is bringing its own platform. And there are a number of platforms in the field, which our field workers are facing very, very difficult, and they are actually, confused. So, we time and again we are saying to, sort of merge it, and maybe one data entry point, and it should fetch in all the other data format. So that we are pushing it, but then still that is the major challenge we are facing.
I think true that, and like to wrap up, now that we have discussed our journey, how we are using it, now what would be your final message to fellow FETP officers or even future FETP officers, and also how we as a group can engage with policymakers better? If each of you can tell in one minute, I think that will be the final thing that I want to. Let me start with Seema. Yes.
Can you repeat once more?
So my question to you, Seema, is like how we as FETP can leverage our network and engage better with policymakers. Like, what do you feel?
Ma'am, my state, Chhattisgarh, is developing state. So now also we are facing, because of COVID, we have went to digital, but then also there is so much gap. Because the higher authorities who are sitting in the state levels, they are not looking the public health. They are only whatever the command they are getting from the central level, they are doing that things only. So the data interpretations and everything, we are keeping excited, suffering. Because whenever at the end of the financial years, they are just asking us, target pura karo and fund complete karo. So as FETPs, we are facing so much challenges because we can't to interpret it. We can't implement everything because the higher authorities are not giving us chance.
Correct.
So we are hoping in futures our state level or district level high authorities will know the importance of FETP or public health, why the quality is data is important, not the
Correct.
quantity of data.
Yeah. Yeah.
So
I agree.
yeah,
Yes.
so
I
main
think
thing
that's an
is
important point that you're making.
Yeah.
Like with more and more FETP, like what we aim to achieve with the state cohort is if we build that critical
Yes,
group
yes.
in the state,
Yes,
and
yes,
as you grow within the system,
yes.
probably we'll have more people understanding data better.
Yes,
right?
ma'am. If we are giving some ideas also,
Yeah.
they are saying, usko side mein rakho, what we have asked, first give that things. So, like that they are asking. So, our ideas, वो डब्बे में चले जाते हैं. So, now one state consultant is also doing the second cohort. So, she is helping that
Correct.
whatever my ideas I am giving,
Okay.
so she is giving it directly or indirectly to the nodals.
Okay.
That सर ऐसा करते हैं तो अच्छा रहेगा डिस्ट्रिक्ट में हमारा प्रेजेंटेशन अच्छा रहेगा और हम लोग नेशनल लेवल में बहुत अच्छा कुछ कर पाएंगे सो slowly it will improve but now most challenges are that the higher authorities they don't giving importance to the public health so that okay
आप बताइए मैम, what do you think कि हम can we leverage our strength as a group and can we engage better with policymakers? What do you feel?
Yes, ma'am. Actually, yesterday night we were talking about that we did FETP, NCT, and we are not. Maybe sometime I will leave NCT, I'll go somewhere else
Correct.
also. But that skills are always with me, what I have learned through. And second thing, we are here in public health just with one name to contribute something for the society.
Yeah.
So when you have skills and strength to do that, then wherever you sit, you should keep trying. And whenever you get chance to show it directly, indirectly to the policy makers, for me, I think we should show the clear picture. We should not fabricate the data because ultimately they have to take decision and it has to be straight coming from the right information.
Correct.
So whenever it is like for us in FETP, like firstly we should interpret it rightly so that there should be no flaw. And we should convey it correctly to the seniors. And whether it may can threaten your job also, but be clear that you have to be justified to your health like contribution.
Nice.
So that is what we can help in.
What do you think, Tejpal? Like, how do we better engage with policymakers?
If like to add, like to recommend FETP or having more field
No,
epidemiologists or
in any way. Like, my question is, we are here as a network, as a group, and we all understand public health, we all understand field epidemiology. How do we better leverage ourselves as a network and maybe bring those policy changes which we have not been able to bring? That is,
I think like we can have success stories around like work done by officers that can be presented, and many times actually officers can be ambassadors rather than faculty or senior leadership going and asking policy leaders that this is the course. So I think the officers can be ambassador for like the success because of
I think that's a good point.
FETP, how it has helped. And I mean, like most of the officers actually they are the ambassadors in their districts, states, and national offices. Second thing, like we need to remain connected so that we can learn from each other, having community of practice where like we can meet quarterly or like after some intervals online. We can have online platforms where we can share stories or whatever we are doing, so that because like today's exercise in Mentimeter actually was kind of mirror. Yeah, and we felt confident actually because most of the answers were correct. Right, so these connections actually give you the confidence.
What is your
Just
thinking, Prashant?
Yeah, just to add, I resonate with all my colleagues, so I won't repeat whatever has been told. So I just add to them. I remember a few months back, Raju Bell sir had come to Manipal. So I had the opportunity to escort him. Then during that time we were discussing. I was telling him that these DCs, IAS officers. So when they are getting trained in national training institutes.
Correct.
So Simla, Manali, and all those places.
Mussoorie.
When they are getting trained, so it is better to inculcate some of the good practices
Correct.
in FETP.
Yes.
Most of our IAS officers are not knowing what is FETP.
Correct.
For example, recently
So we should push
NCDP.
for one module in Mussoorie, sir.
Recently,
We'll go.
recently, I'll just
We'll
tell you
go
the
and
story. I'll tell you the story. Recently, NCDC people had come along with Sukama sir,
Yes.
and my PRS didn't know what is EIS, what is FETP, and deputation was denied for them.
Okay.
Okay, so most of our higher IAS officers are not knowing what is FETP. And what is the contribution of FETP also? It's very, very difficult for them to comprehend. So unless they are trained somewhere, so and know the importance of correctly interpreting data and all those kind of what FETP graduates can actually contribute to the well-being of community. So unless they know, because they are the ones we can actually influence the policy. So unless they know, it is very, very difficult for us to push
completely
forward.
agree.
So one such training, maybe 1 day or 2 days during the training course would definitely help. And Raju Behal sir actually positively noted that one, and he appreciated. So he said something of that sort will be done.
Yeah, yeah.
Thank you
Actually,
so
even internally, I'm not sure if Prabdeep ma'am and Ganesh remember, I think we were thinking of like executive MBA, executive FETP for the IAS people. That was one of the ideas that we were thinking earlier, and happy to know that Prashant has brought it to the leadership as well. I think that's an important step, sir, because most of them are dealing with policymakers. When they don't understand what we are trying to say, I think it becomes very difficult to bring change. I think that's a very good note to end on what we have been. I think I have had a really fun time talking with all of you, and very happy and proud to see that the varied achievements and how you are using FETP, skills and knowledge even beyond graduation. I think that's what mentors and faculty would be happy with. So thank you very much for joining us. I know we didn't give them much time, sir. We only told them last evening. So I'm very happy with the confidence, the ideas that they're bringing.
That's when we taught communication.
Yeah. So thank you so much. Thank you everyone for the patient listening.
Thank
Thank
you.
you.